Hi, my name is Jennifer. I'm going to go ahead and start out by giving a report on this patient. Patient is a 63-year-old male. He was admitted last night to the ED. Admitting diagnosis is congestive heart failure and secondary pulmonary edema. The physician is Dr. Sim. Patient has no known allergies and he is a full code. He was admitted yesterday with complaints of chest pain and shortness of breath. He does have a past medical history of CAD, diabetes, obesity, hypertension, and he does have a history of an MI, which was 3 years ago, and at that time there was a coronary stent placed. He had a chest x-ray last night, which did indicate enlarged heart as well as pleural fluid in the lower lobes, confirming pulmonary edema. His labs, creatinine was high at 2.0, BUN was 30, and his sodium is 132, and BNP is 600. He did have his glucose checked at 0400, which was 280. He is a Q4 Accu-Check. His vitals were completed at 0400, BP was 180/90, pulse is 99, respirations are 22, afebrile, SpO2s 2 liters, nasal cannula, he is setting at 92%. His pain at 4 o'clock was 4 out of 10. Patient is ANO times 4, crackles heard bilaterally in the lower lobes. He is on tele and he is sinus tachycardia. He did have a fully placed. Appears 600 was put out overnight. Urine is yellow and clear. His pedal pulses were bounding but equal bilateral. Radial pulses equal bilateral. Skin is intact. He does have edema, 2+ pitting edema on the lower extremities. 2 IVs, one in the right forearm, 20 gauge, one in the left AC, which is an 18 gauge. Right now his medications due are Lasix 40 milligrams IV push and hydralazine 10 milligrams PO. Right now the plan of care is just strict INOs and treating the fluid overload and the blood pressure. We're waiting on cardiology for further information. All right, so this patient has Lasix 40 milligrams IV push. We're going to make sure this medication is given over 2 minutes. You're going to explain any side effects, so like ringing in the ears. Explain to the patient it's going to increase urine output. That's why we placed a Foley, because he's going to be going to the bathroom a lot, and just educate the patient on why we're giving it to him. He is fluid overload. He has edema. This is going to hopefully help get rid of some of that fluid and give his heart a break. The hydralazine, same thing. We're going to explain why we're giving it to him, help control that blood pressure, bring it down to a more stable range. As far as strategies used to reduce medical errors in the clinical setting, technology is used in several different ways. Starts in the medication room. The med room has a MAR. This MAR only allows you to access one patient at a time. It allows access to meds which have been ordered for the patient only. So if it hasn't been ordered, it won't let you pull it. And it does also ask you to confirm the dose to ensure that you're pulling the proper dose out of the drawers. Once you get back to the patient's room with the medication, this is where you scan the patient's wristband to pull up the MAR in the chart, and then you scan the medication, and as long as it's the right time and the right dose, it's going to allow you to continue. If for any reason there is that order is not correct, or that medication is not the correct med, or not the proper dose, then you're going to get an alert, and the system will keep you from moving forward with that medication administration. That's why it's also important that you always make sure the wristband has the correct information, patient's date of birth, proper name, and of course any allergies are noted at that time. So once you scan that, there also may be parameters. So in this case, we're giving hydralazine. There may be parameters set in place for that medication. So it'll ask you to enter the patient's blood pressure, or it'll go off the most recent vitals, ensuring that the proper dose is being given, and it matches with those parameters that the physician provided. So when giving this medication, it's always important to go over your 6 rights of medication administration. These rights include right patient, making sure you have the right medication, you're giving the right dose, through the right route, at the right time, and of course the proper documentation. The 3 checks completed, the first check should be completed in the medication room. Here you're verifying your order with the MAR and the medication. Then your second check is completed before you go back into the patient's room. You want to make sure that you have the right medication, that it verifies the MAR, that verifies the order in the MAR. And then your third check, of course, is done at bedside, verifying that name, date of birth, and asking again one more time about any allergies, and verifying that information with the medication and your order. All of this should be completed every time with every patient, with every medication. Once you give the medication, you're going to go over the side effects. And then you're also going to assess. A lot of times this is something that is not done, or nurses may be getting in a hurry. And it's so important to assess. You want to assess your patient once you give that medication. Make sure they're not having any side effects or adverse reactions. You also want to assess that it's working. So with Lasix, you're going to assess frequently that urine output. Make sure it's pulling off that fluid. And then with the hydralazine, you're going to assess those vitals. If it's this high, you're going to check it in 15 minutes or within the hour. Make sure that it is bringing that blood pressure down, that the medication is effective. Some unsafe practices that I would say would be solely relying on technology. So just scanning that wristband, scanning the med, and not looking at things. I think that can be something that's unsafe. And I think with technology, and distractions, it can be easy to do that. But I think just making sure you're doing your checks with your eyes and keeping that patient safe. So that's all I got. Thanks.